So I'm very excited about today's webinar, and as I mentioned, Road to Wife is kicking off this first session with Gennady Daich, and we're gonna speak about how to be HIPAA compliant in MedTech. As I mentioned, Rod is an expert in compliance and expert and other regulatory aspects, bringing products and businesses into the United States. And he invited today as a first speaker Gennady Daich, who will speak about HIPAA compliant in MedTech, and he has a lot of expertise in this specific field. Use the opportunity to learn from the best people in this field and ask you specific questions. We'll try to address them during our limited time. I will let after a few slides, I will let Rod to introduce Gennady better, but I just wanted to say that Rod already on, he is part of our global network, our network of leaders of the global world community in the United States, and he is committed to help you bring your products and services to the United States market, and he is trying his best, and that's why he created not only like activities of doing webinars, but also his own group on our network, which is called Go Global Expert and Compliance. And so we will share the link in here, and you could join and ask a question later on and bring other entrepreneurs in that group where he will be helping and assisting you with all those questions. A few quick questions about the community. We are a network of entrepreneurs for entrepreneurs. In order for you guys to access global markets, access customers, experts, and probably raise capital, depends on the goal you're trying to achieve. This is a free nonprofit community, but there are expectations from the members. You need to be active on the community, and you need to help out each other going global. So one entrepreneur, for example, in Singapore would like to get to Australian market, and an entrepreneur in Australia can help them with his expertise, connections, and other things. The guy or the woman from Australia who's doing business there, they would like to get to Mexican market, and entrepreneurs from Mexican guide them how to do this in Mexico. And this is the power of network, and with a strong reputation, we are helping out each other to achieve business goals and going global. This is our global team. We have over 30 people on our team in 30 countries, and those people are all committed to help you, so use this opportunity. But on our network, we have over 2,000 members, entrepreneurs from around the world, and they are all willing to help each other and you if you're joining us. This is the networking bot. If you need to extend your global network, this bot can offer you one person from our network for free, we're not charging anything. So it's automatically offering you a new contact every week. So use this, it's an awesome free resource. These are our stickers, so you can enjoy and have fun. And we have amazing speakers coming to our community, and it's not for the sake of views or likes. It's actually giving back, helping you to go to the next step. And nowadays it's super important because building businesses is not easy, and access to information, how to start global companies, in my opinion, has to be equal and free. And so these amazing people like Bob Dorf, Ilyas Tribulaev, Donna Griffith, Steve Hoffman, they are known not only in the United States, but globally. And these people are coming to help you to build your businesses and create new value in the world. On this note, I just wanted to add that these are the contacts of Go Global World community. And if you would like to learn more about us or join us, just go on our website. And if you would like to become a leader in certain country, just reach us out. We might consider that. We don't consider everyone. We are pre-selecting people. It's a process to become a leader. All other offers and opportunities you would like to share, just reach us out. We are happy to help, happy to hear you out, and etc. On this note, I'm passing the word to Rodion Rod-Tuvaev, a leader of Go Global United States in Los Angeles. And I'm excited because this is your first session on our community, and the floor is yours.
Good morning, everybody. So thank you very much for introduction. Me and Gennady, we will make a short introduction of ourselves. And the main thing I want to tell you, to share with you, that we are helping foreign companies to reach the highest level of regulatory compliance and regulatory requirements in order to start a business, in order for entering the US market. And I would strongly repeat to you that in your go-to-market strategy, of course, definitely, no doubt, you have to think about compliance. We can call it to make your homework. Not that your product cannot be reached by a potential customer, and more that compliance officer of your potential customer, client, distributor, they will be not interested in your product if your product is not compliant. And that's why I'm sure, and my colleague Gennady will share with you with his 20 years of experience in healthcare industry in HIPAA compliance for medical software, that main thing you should create in preparation level. First thing, regulatory compliance pathway, and then actual implementation. And only then you can start thinking about marketing and making some sales activities. And I want to introduce a leader of RoadUp.us, our company, to Gennady. He is a leader of medical software, HIPAA compliance. Gennady, and then we will continue with Q&A, and we will make the review of case studies. Gennady, hi.
Hi, thank you, Rod. Thank you. Let me share these slides. You guys can see them, correct?
Yeah.
Okay. All right. Good morning, good afternoon, everybody. Thank you for attending this webinar, and thank you, Go Global, for organizing and hosting this event. We really appreciated that. As Rod had mentioned, we are very serious about HIPAA compliance, and throughout this presentation, I hope you will learn and understand very important and useful information for you to take away in terms of HIPAA. Before I dive into a lot of materials I have prepared for you during this presentation, let me just briefly tell you about myself. I have been living in the United States for this past almost 30 years, all in California. I am a professional internal auditor. I also have professional licenses such as Certified Internal Auditor, Internal Audit Professional in Healthcare, and Certified Risk Management Assurance. I have bachelor's degree in accounting and master's degree with emphasis in healthcare management. Throughout my career, I held many various positions. My first position as an auditor, I was a contractor to federal government. Our Medicare insurance called the Medicare, I'm sorry. And, I used to audit a lot of hospitals throughout the United States. Some of you might be familiar with a company called Ernst & Young. This is a global consulting firm. I was also an auditor there for a period of years. I also worked for big hospitals, big healthcare companies, as well as behavioral health organizations. I held position as compliance director and HIPAA privacy officer. As I mentioned, I'm a professional internal auditor, and throughout my career, I've conducted a lot of audits in operations, finance, and IT. I want to make a disclaimer, I'm not an IT professional, but throughout my 20 years of experience, I have dealt with a lot of chief executives in information technology, directors of IT, a cybersecurity expert. I participate in professional conferences and learn myself about cybersecurity. And again, I conducted various audits in IT fields. So I feel comfortable that, again, I'm not truly IT professional, but because of my vast experience and conducting audits, I believe I really understand the IT infrastructure and so forth. As a corporate compliance officer, I oversaw compliance programs for companies. Again, I was overseeing HIPAA compliance, policies and procedures. Also, part of my roles was conducting trainings similar to this, or webinars to employees, to consultants on various topics, again, on HIPAA and privacy, security, corporate compliance, ethics, fraud, waste and abuse, and so forth. Throughout this experience, I had helped companies to draft policies and procedures on HIPAA, conducted HIPAA risk assessment, business continuity plans, disaster recovery plans. As I mentioned, I work with a lot of CIOs, which is Chief Information Officers, to implement cybersecurity framework, which we're going to be discussing during this presentation. These are some of my audits I've conducted, as I mentioned, on access controls, on incident management, asset management, vendor selection, and so forth. Again, I oversaw audits in on HIPAA. Federal government conducts this audit on healthcare organizations. I have not participated in those, but I did participate in the state of California HIPAA audits. And I'm very familiar what HIPAA is looking for from state of California, for example, when they auditing healthcare organizations. So let's talk about HIPAA. You heard about HIPAA term, but you might not probably realizing what it means. HIPAA stands for Health Information Portability and Accountability Act. So the abbreviation is HIPAA, H-I-P-A-A. And this is a federal law that protects the confidentiality or privacy of records of patients who have been treated in various healthcare facilities. So HIPAA has been in existence since 1996. So please realize, so next year, for example, will be a 25th year anniversary of HIPAA. So as you can imagine, it's been a long time since HIPAA been introduced into law. So again, this is a Federal Government of United States Act of 1996. It provides a framework for establishing protection of client. When I say client, I mean patients, confidentiality, security of electronic systems, standards and requirements for electronic transmission of health information. So HIPAA consists of 4 parts, or they call it rules. So there is privacy rule, security rule, breach notification, and enforcement rule. So throughout this presentation, I will hopefully you will get more information once I go over each of these rules. Again, these are some of the dates I'd like for you to understand, kind of put you in perspectives of the timeline of the HIPAA law in existence. So again, it's been enacted in 1996. The actual rule came in 2003, then followed by security in 2005, High-Tech Act, I'm going to discuss it later on, breach notification, and omnibus final rule in 2013. So as you can see, it's not like it's been developed in 1996 and that's it. No, it had been so many other changes throughout the years. The omnibus rules, it basically straightened the standards on business associates and business associates agreements. I will be discussing what business associates later on. But to give you an idea, business associate is an entity that is transmitting, receiving, processing healthcare records on behalf of an organization, which is called a covered entity. So since we're talking about the software, for example, let's say you guys develop software for medical providers or for dental clinics. And you'll be selling the software to dental clinic. So dental clinic becomes what HIPAA refers to as a covered entity because they provide treatments to their patients, but they use your software to house all this information on their patients. So you become a business associate. So you're working on behalf of that covered entity. So again, the dental clinic, medical provider, a hospital becomes a covered entity in the eyes of HIPAA. And you as a provider of software products to that covered entity is considered to be a business associate. So these rules basically talks about what the standards that business associates have to follow. Throughout the presentation, I will discuss more in regards to this. In regards to HIPAA enforcement, I want you to realize that there is a Department of Health and Human Services of Federal Government of the United States, abbreviated HHS, as you may be heard, or you probably can search, of course, yourself. You know, United States has various departments. There's Department of Transportation, Department of Justice, Department of Homeland and Security. For example, if you fly in, to the United States, you have to go to the security checks. You see these ladies and gentlemen in blue outfits, uniforms. That's the Homeland Security team. Similarly, for healthcare, there is a Department of Health and Human Services. So they oversee HIPAA regulation. There is an office, it's called Office for Civil Rights, or abbreviated for OCR. So that's a division of Department of Health and Human Services that enforces the laws around HIPAA. Those are the personnel that conducts those HIPAA audits I had mentioned before. Similarly, any medical fraud is handled by another office of Department of Health and Human Services called OIG, Office of Inspector General. So kind of give you a perspective, I have an example here. So Department of Justice I had mentioned, and you probably, everybody here, FBI, right? Federal Bureau of Investigation. So Federal Bureau of Investigation, FBI enforces the laws for Department of Justice. So similarly, Office of Civil Rights enforces HIPAA law. So I want you to understand that federal government, because it's a federal law, there is enforcers who enforce the laws from federal government. In regards, I had mentioned already about the business associates. So again, you probably will provide your software services to the covered entity, and you will be housing this information in the cloud space. Am I right? And so you will consider to be a data storage company. So under HIPAA, both covered entities and business associates have certain rules and liabilities, and they have to meet certain standards because they're working on behalf of covered entities, because they process EPHI, which is Electronic Protected Health Information. I'm going to be discussing later on what it means. So basically, it's the healthcare record of patients. Before in the in 90s or early 80s, we had those manila folders, they call it, just actual folders. When you go to visit a doctor, they write a diagnosis, they give you a prescription, they put this in a folder. But now, of course, with the softwares, with computers, so all those folders become tabs in a software. So that protected health information now becomes electronic protected health information. So HIPAA governs how that protected health information has to be kept confidential and private by business associates and covered entities. So let's talk about, again, the first rule is the privacy rule. So basically, privacy defines how client, again, when I say client, I mean patient, when patient information is used and disclosed. So again, when you go to see a doctor at a hospital, they will provide you what we call a bill of rights or privacy rights. As a patient, you have certain rights in terms of who and how your information will be used. So those rights will be described in this notice of privacy practice. It's a little brochure that they will give you at the hospital, and the hospital will tell you that since you're going to be receiving treatment at our facilities, we're going to use your information certain way. And we have to disclose it certain way also, because we have to give you treatment. So privacy rule is basically defining of all the standards in terms of how the healthcare providers must use and disclose their patient information. So now this is what we're talking about, privacy rule. So basically it outlays the ways how this protected health information, or PHI, protected health information of patient, has to be safeguarded by healthcare providers. When I talk about PHI, again, protected health information. That's a HIPAA term. There'll be a lot of HIPAA terms throughout this presentation, so please bear with me. So protected health information includes personally identifiable information, or another term, PII, such as names, addresses, dates related to patient, their date of birth, telephone number, social security, and so forth. So again, when you go to a hospital, you have to provide with what they call demographic information. So they're gonna ask you for your name, for your social security number, for your address, date of birth, and all that. So all that combination of all this data becomes protected health information, because you are being treated at the healthcare provider, and this healthcare information becomes protected health information under HIPAA laws. So like I mentioned, in terms of electronic healthcare information, so all of the data is stored in some kind of software. So a lot of hospitals have electronic healthcare record system or electronic medical record system, EHR or EMR. So they're gonna store all the demographic information. They're gonna document the doctor's notes, nurses' notes. They're gonna document your medication prescription, your lab information. So all those tabs, you know, like in the software or in the website, when you go, you see all these tabs across the way and horizontally. So software, as you can, I'm sure you guys know, so all these tabs will house all this various information. Again, on your diagnosis, on your prescription, on your doctor's notes, on your lab work and all that. So that becomes electronic protected information. So the next rule, the security rule of HIPAA, has all the standards in regards how a healthcare provider has to protect all that electronic protected health information, so it does not be released to unauthorized parties. So it has to be safeguarded and kept confidential. So again, security rule. When privacy, we talk about all the data on the hospital, from the hospital healthcare provider. For electronic protected health information, the standards or the HIPAA rules describe how patient information has to be stored and properly accessed and kept confidential. I will talk more about this, throughout the presentation. Another rule they call HIPAA breach notification. So in the situations when the healthcare data, protected health information, is breached or hacked or released to unauthorized party, or for example, there's a lot of issues regarding email, because email has to be encrypted. That's one of the standards for HIPAA security. When you send an email, when the healthcare providers exchange emails with each other or to outside world, they have to encrypt their email. So when they encrypt that email, I'm saying there is a protected health information attached to that email. So they want to send some information on the patient or patients to somebody. They have to protect or encrypt that information. So if that encrypted information somehow gets to wrong hands or get hacked or sends to wrong individuals, now we have a breach, because they're not intended individual, they're not intended recipients, or it goes out to the public. Let's say public knows everything about you right now with all your diagnosis. It means the healthcare provider has committed a breach. So there's certain rules. Once this happens, hospital, for example, requires to notify, first of all, a patient that the breach has happened. Then they have to notify the supporting, let's say, the state body which they operate, and they have to report based on the number of clients that the information had been breached, a federal government, and they have to even report to the media. If it's more than 500 patient client or patient data information had been breached, we have to notify even the media. So there has to be a newspaper article and and informing of that. And then there's a website. We have to go in the federal government and report a breach. So anyway, so all these rules are described in another set of laws for HIPAA called HIPAA breach notification. Again, so think about this like manuals. So we have HIPAA privacy manual, HIPAA security manual, and HIPAA breach manual. So that's a third rule of HIPAA. Again, excuse me. So breach is impermissible use or disclosure under privacy rule that compromises the security or privacy of protected health information. So a business has to conduct a certain business breach risk assessment. So they have to go through all these 4 factors to determine if it's a low or high probability. Depending on the probabilities of this breach, then there's certain reporting requirements. If it's low probability, you follow this path. If it's medium probability of this breach, we follow this path. If it's high, then we go this way. So these numbers 1 through 4, these factors, there's a certain tool that we have to fill out called breach risk assessment. And this is something that, for example, federal government will be reviewing if you've been subjected to an audit from the government. There's certain exceptions to this breach. I don't want to bore you with that, but again, you have to document those. But just keep in mind, again, so a breach is something that has been disclosed that compromises the security and privacy of protected health information. Again, this information is protected. You have gone to the hospital, you have certain diagnosis, you don't want anybody to know it unless you provide written authorization that your spouse, your relatives, even your friends can view and can know this information about yourself. But if you don't have authorization or permission to release that information, your information only belongs to you as a patient. And a hospital who provides treatment to you has certain rules to protect confidentiality of the data. So if that data is being compromised in any way, so they committed a breach. I'm talking about, a hospital. And they have to follow certain rules to notify governing bodies of that breach. Let's go back to the business associate. Again, let's take you as an example. You developed a software, again, for dental clinic, for your behavioral health organization. You provided a software product to a mental health provider. So again, they are covered entities. So remember the term covered entity, because they provide treatments to patients, but they use you as a service provider of the software, and you become their business associate. So all their healthcare information of their patients is stored and used by your software. So you are considered a business associate. So HIPAA regulates standards for both business associates and covered entities. So again, simply, hospital is a covered entity. Hospital's electronic healthcare record system, a vendor who provides that system to a hospital, is considered to be a business associate. I already mentioned about the covered entities. Again, hospitals, physicians, providers. Think about providers of healthcare. They're treating patients. They're a covered entity. But again, they use systems that all this data is entered and inputted and reported. And that's the software that you guys are providing, and you become a business associate of that covered entity. So under HIPAA, you as a business associate have certain rules and liability if you don't follow HIPAA standards. For example, you're directly liable for impermissible uses and disclosure. So if you commit a breach, because again, I'm assuming this information will be housed in your cloud. So if you don't have cybersecurity controls, if you don't have strong access controls and so forth, and you had committed a breach of the healthcare data of covered entity, you will be liable for that breach. If you fail to provide notification to covered entities, so you found a breach, you must conduct investigation and you have to report to your covered entity, to that healthcare provider that you're working on behalf of, and so forth. So again, so throughout the years, with all these rules and acts, HIPAA put more liability on the face for business associates. So all this were applied before for covered entities. So healthcare providers, hospitals have to follow all these rules since 1996. But then as the software, industry had progressed and so forth, so federal government had realized that covered entities are using vendors who provide software. And wait a minute, but all that information is being also used by the software vendors. So now we want to make those software vendors who provide software services or the packages also responsible for HIPAA rules and regulations. So again, so over the years, HIPAA made more rules for business associates. So again, as I kind of mentioned, as a business cloud service, you have to have certain audit access and monitoring, and you have to come up with proper authentication procedures. So again, at your company, if you are software provider, you have to have strong access and authentication procedures. And you want to make sure you have cybersecurity controls to make sure your data is not being hacked. And actually, it's not your data, it's data of your covered entity that you are processing on behalf of. So you have certain rules and regulations again. So again, think about HIPAA controlling both entities. There's covered entities, people who provide actual treatments, and then the service, the software companies that they use. HIPAA enforcement. Again, I mentioned about Department of Health and Human Services, Office of Civil Rights, and Department of Justice. So there's very significant fines and penalties for breaching HIPAA rules. And this is another manual. Again, we have privacy manual, security manual, breach notification, and enforcement. It's another manual set of laws HIPAA talks about. And as you can see from the graph, the violations of HIPAA that you commit might be ranging from $100 to all the way to $1.5 million. So HIPAA enforcement talks about in which situations you will be subject to either 100 or all the way $1.5 million. On this graph, as you can see, there are what they call tiers or the different categories. So tier 1 through tier 4. So as you can see, the tier 4 is the red category, is the violation of 50,000 per violation, and it could maximize to 1.5 million per year. Please realize, so HIPAA fines and penalties could be civil penalty of 50,000 per violation. So a healthcare hospital or a hospital will pay a penalty, but also individuals committing this crime will be subject to criminal violations, so they can serve time in jail. So violating HIPAA is not only they're gonna take your money away, but you can be in jail. So I'm sorry to make it very strict and serious at this moment, but I want you to realize HIPAA is a very serious matter. Again, not only companies will be losing money, but their individuals can end up in jail. So Department of Justice, the FBI, will come knocking at your door. So again, as you can see, 5 years in prison. So this is very, very serious matter. The federal government takes very serious of protecting healthcare information of United States patients. I had mentioned about the OCR, Office for Civil Rights. Another thing I want you to mention, is the HIPAA wall of shame, they call it. You can Google it. You can say HIPAA wall of shame. And basically, it will list all the healthcare providers that had committed breaches over the years, over the past 2 years, actually, and what had happened, how many client records had been breached, and so forth. So if you can realize, so that information becomes public. So not only as a healthcare provider, you're gonna lose money, but you're gonna lose your reputation because your information will be now public information. So you don't wanna end up on that wall of shame. So again, this is just something I want you to realize. And this is what it looks like. Again, you can just Google it. You just say HIPAA wall of shame, and this information will pop up. So again, the another act, as I mentioned, is the HITECH Act, and basically they straightened, put more stringent requirements for HIPAA, and they actually increased the amount of penalties to 1.5 million. So again, this is just an extra layer on top of the security rule. Again, we talk about these violations now from $100 to $50,000 per violation. So again, a cloud provider, that provider of software service or software package becomes a business associate of a covered entity. And because they are storing the protected health information on behalf of that covered entity. So they are considered a business associate, and they will be subjected to penalties and violations if they breach that protected health information. So that HITECH Act basically specified all that for business associates. So I had already mentioned about protection of PHI, or the Notice of Privacy Practices, the Patient Bill of Rights. So again, when you hear the word HIPAA privacy, think about patient rights. So again, patient has a right to receive this notice or brochure that will specify the use of and disclosure of the information. And they have certain rights to that information. We already mentioned about the protected health information. Again, the HIPAA calls this data as client or patient identifiers. So again, identifiers for the data would be names, medical record number, social security, license number, health plan numbers, and so forth. So again, combination of all this information that can identify the patient is considered to be a protected health information. So HIPAA regulates and provides regulations for hospitals and healthcare providers what has to happen in terms of protecting that data. So again, use, when HIPAA says use, it's like how we're gonna use the data when they treat the patients in the hospitals, and to whom they're gonna disclose, because they might disclose this information. Let's say there's a law case, they might disclose it to an attorney. They actually can give a copy to a client or patient themselves. They can actually fax these records to another healthcare provider. So again, so that privacy rules talks about how HIPAA will disclose and use the protected health information. There's also a couple of more terms for HIPAA. It's minimum necessary and need to know. So when they request information for a client, you don't give them the entire medical history. You're only gonna give them what is necessary for that request. And this is called minimum necessary. And also another term is called need to know basis. So for example, there are employees working at your company, and they only need to access certain clients. They cannot have access to all the clients in your system. They only have to have access to the client's data, whatever they're doing, updating, only to those patients they're working on. They cannot have access, although they're working for your company, they have access to your software, but they cannot have access to all that patient data. So that's another term HIPAA uses, need to know basis. Another term for HIPAA, treatment, payment, and operation. So remember, I talk about authorization. So there's certain times that the healthcare provider will not ask for patient authorization because they are treating and they are making payments, or I mean, not making payments, they're getting the payments from the insurance companies. So imagine the thousands of clients they see, they have to get permission from each of the client if they can send this information to a billing company. I mean, it's going to be a mess. So HIPAA allowed healthcare providers to not get authorizations in this situation if they're providing treatments and payment and they're just doing business operations for that clients. But again, if you as a patient wants to release information to somebody about your diagnosis, you must give permission or authorization to that individual. But again, if you're being treated at the hospital, and the hospital collects payments from you and from insurance company, they're not going to ask permission for you to authorize them to do so. So that's what I mean by treatment, payment, and operation. I mentioned about key patient rights. So again, I just want you, I bold them here. So you as a patient have a right to inspect and get a copy of your protected health information. You have a right to receive that notice of privacy practice, and you have a right to file a complaint. So again, privacy talks about all of these rights for patients. So again, I want you to understand that although it's your information, it's housed at the hospital, but you have a right to get a copy of that information. And if any of these rights are not provided to you, you have a right to file a complaint. And I was a HIPAA officer, and I used to handle those complaints. So these are some of the steps I went through to handle patient complaints. And again, patients have a right to follow up and to the state where they work in, let's say state of California. There's also Department of Health Services in state of California, for example, and then they can follow a complaint or submit a complaint form to the federal government and say, you know, I went to this hospital, but I did not receive a copy of that brochure of that privacy rights or Bill of Rights, so I'm making a complaint. So I just want you to realize, again, so you as a patient have certain rights under HIPAA, and healthcare providers must abide by these rules and by these rights. Let's dive more into security rule, because this is more relating to you, not more, but this is more in terms of your services. So again, when we talk about electronic protected health information, that's that data in those tabs in the software that you as a software provider has to keep confidential. And HIPAA evolves around these three areas: confidentiality, availability, and integrity. So remember the CIA: confidentiality, availability, and integrity. So security rule basically defines confidentiality, that electronic PHI is not available or disclosed to unauthorized parties. Remember, I was telling you, so your information has to be kept confidential. So this is what confidentiality. You cannot make it available to unauthorized persons. Integrity, that ePHI, electronic healthcare information, is not altered or destroyed. So again, you have information in your software. It cannot be destroyed or altered by unauthorized individual. If you give access to certain individuals who can alter this data, they have a right because this is their job duty, but somebody else cannot destroy this data. So this is what it's called integrity. And availability, that software product is available throughout, 24 hours and so forth. And that is what, of course, cloud comes in. So basically, HIPAA security rule talks about meeting all of these key elements: confidentiality of protected information, its integrity, and its availability. So you as a software package provider has to make sure all of these elements are in place, that data is confidential, there is integrity of this data, and then it's available to covered entity. Again, HIPAA security, confidentiality, integrity, and availability. That's exactly what they specify in the laws. So they require healthcare providers, when they're protecting their health information, that they meet these three regulations: on confidentiality, on availability, and on integrity. And here, let's dive into more detail. So HIPAA security rules, that manual, remember there's a third manual, there's standards, and they call them safeguards. And they call them in these categories: administrative, physical, and technical. So this is basically the bulk of regulations for HIPAA security. And this is what you must meet as a business associate of a covered entity. You as a software provider, you a business associate, again, I keep repeating, you have to be HIPAA compliant in HIPAA security. And these are the standards, safeguards you have to meet: administrative, physical, and technical. And there's various policies and procedures I will briefly talk about later on. So, but you can see it here: security management, security awareness, contingency planning, in physical safeguards, workstation use, facility access, in technical safeguards, access and audit control, encryption, transmission, and all that. So let me give you a hint, or not hint, I'll let you know. It's about 80 policies. So you have to have about 80 documents, written documents describing all of this. So as you can see, that's not 80 here, just a summarization, but I kind of give you a heads up because I was the one who developed those policies, working closely with the CIOs, Chief Information Officers, and we created that HIPAA security manual for the company, and we had 80 such policies, and we broke it down to administrative, physical, technical, exactly like HIPAA requires. So there's a lot of policies. You have to have it in place. Of course, you have to have training and so forth. I'm going to mention later on. But again, so this is the HIPAA security rule. In order to be HIPAA compliant, you have to meet these three safeguards: administrative, physical, technical. I want to briefly talk about here. So here's a top 10 HIPAA violation that had occurred in a couple of past years: lost and stolen devices, hacking, employee dishonesty, improper disposal, and third-party disclosure, improper third-party disclosure. You can Google it, you can search it, and but as you can see on the right, a lot of healthcare providers over the years had been subject to huge number of fines. Look at the numbers: 2.7 million for lack of risk analysis, 750,000, 850,000 for failure to conduct analysis, failure to be HIPAA compliant in terms of business associate, 750,000. Look at the Anthem, which is a big insurance company in the United States, $16 million. I believe this is one of the largest fines ever, and 5.5 million for another one. Yes, you might think this is a huge company. They have billions of dollars, like Anthem has billions of dollars, but still, $16 million, it's a huge amount of penalties subject to a company. And of course, if you are a very small company or decent sized company, I mean, tens of hundreds of thousands of dollars spent on HIPAA, it's going to be a huge drawback to your finances. So again, and this is what I was talking about, HIPAA wall of shame. So all of that information, you can define a HIPAA wall of shame, or you can just say HIPAA fines and violations for the past 2 years, or healthcare organizations subject to fines and so forth. You can just, Google it. But again, I just want you to realize the number and the amount of fines. I mean, this is staggering. I mean, these are huge numbers. So again, and remember what I told you, this is not only civil liabilities, which is the amount of money, but criminal liabilities. People will be ending up in jail. Okay, so let's go on a more lighter note. So again, you are a business associate, you provide data on behalf of healthcare providers. You have a data control. You are controlling their data, and you're supposed to have a business associate agreement. So that relationship between you and a covered entity has to document it in what they call a business associate agreement. So the business associate agreement will specify what exactly your responsibilities in terms of protecting of the data, and covered entity also has responsibilities themselves. So again, HIPAA over the years had required implementation of that agreement. So again, you are a business associate. When you're gonna be purchasing, your software will be purchased by a healthcare organization. Be an understanding that they're going to be giving you a business associate agreement for you to sign. It's a requirement. If you don't sign that agreement, first of all, they're not going to be in business with you, because they will be anticipating you will be signing business associate agreement. While you're signing your business associate agreement, it implies that you follow all the HIPAA security rules. So again, what Rad mentioned in the beginning, this is very important. Before you even think about proposing your business software or your healthcare software to an organization, you have to have all these policies and training in place, and you have to show this by signing this agreement, because that's the expectation. If you sign in this agreement with the hospital, they expect that you have follow all the HIPAA security, because they will be asking for copies of those policies and evidence. For example, you had conducted risk assessment and provided trainings to your own employees. So again, this is not just a document to document the contractual relationship between two companies. This is a document stating on your behalf that yes, I am certifying, I am a software company, I follow and I have I meet all the HIPAA security requirements. So I want you to really realize the importance of this agreement. And again, as I mentioned before, you probably realize as a software professional, so IT professional, data access authentication is very important in the cloud space. So I'm not going to spend too much in this. Here's the important part I want to spend a few more minutes. Cybersecurity. Of course, you guys hear this term everywhere throughout the years. So HIPAA actually took a notice of that, and they, together with National Institute of Standards and Technology States, they come up with the mapping of the cybersecurity to HIPAA. So before that, actually, NIST and IST came up with the framework. And here's the graphic of that framework. Again, you can Google it. You can just say NIST Cybersecurity Framework. So basically, this is an organization that recommends certain procedures or framework for companies to develop to fight, hackers in the cybersecurity space. So HIPAA partnered with NIST, and they came up with this mapping they call a crosswalk between the regulations of HIPAA and NIST. So what we have been doing in our consulting engagements, we help organizations because it's a security, right? So we help them not only to meet HIPAA security rules, but we also help them to implement NIST cybersecurity. So we kind of have both areas tackled. We are helping them to follow and be compliant with HIPAA. And also we recommend them, because this is a highly reputable organization, to also install the policies and processes to fight cybersecurity attacks. So this is the framework I'm talking about. So NIST came up with this framework, and then HIPAA matched the regulations with this. So again, when we consult our clients, we help them to develop HIPAA rules and policies. We also help them to implement the cybersecurity. And by doing so, we feel very strongly that any attacks on that software will be identified, protected, detected, and so forth. And also, again, we're going to meet HIPAA and NIST requirements. And here's that mapping I was talking to you about. So that asset management, for example, as you can see, asset management under identify in this blue color. So here's the function, here's asset management, ID, IM, this is how they stated. And here on the right, I put with arrows, here's the HIPAA. So again, they matching the standards from NIST cybersecurity to HIPAA. And again, we are helping companies to implement both HIPAA and cybersecurity from NIST. There's other frameworks used in the United States. One of them is called Critical Security Controls, COBIT, which is from the Information System Audit and Control Association. For example, as I mentioned, I'm an auditor, so I call the general auditor. And there is an Institute of Internal Auditors I belong to, IIA. But there's another group of auditors they called CISA, Certified Information System Auditors. So there's IT auditors, and there is another organization called ISACA. So that ISACA organization came up with their standards on security. They call COBIT, C-O-B-I-T. And then those of you international, I'm sure you guys hear about ISO, International Organization for Standardization. But in my experience, the most frameworks being used in the United States here are the COBIT, NIST, and HIPAA. And again, if you recall here, so cybersecurity has been matched with all these frameworks as well. So again, this is another point. So once we're trying to help them to implement HIPAA, we also help the organization to match and have strong cybersecurity controls. So again, COVID, NIST, and HIPAA. And Center for Controls, Internet Controls, there's another, they have 20 software standards. Again, those of you in IT professionals, you can find this interesting. Again, you can just search it, Center for Internet Security Controls. So they came up with the 20 key controls that an organization must have to have a strong IT foundation. So they broke it down by basic, foundational, and organizational. So again, so NIST pretty much did kind of the same thing, and they came up with a framework. So CIS, Center for Security Control, Internet Security, also came up with a framework. And then we are matching all of that with HIPAA. So as you can see, by implementing HIPAA, we also, again, helping companies to have strong cybersecurity controls. And now I'm going to spend just maybe 5 more minutes and kind of conclude my discussion. But here I want you, these are the key slides I want you to follow. So again, when we talk about an organization trying to be HIPAA compliant, what does this mean? They have to follow HIPAA privacy, security, breach notification rules. They have to have a leadership in place. They have to have privacy officer, a security officer, typically a chief information officer. They have to have all these policies and procedures in place in privacy. Remember, privacy is how we're going to use and disclose information. So this is mostly for covered entities. But for you as a business associate, you have to follow the security rule. But I'm just giving you overview of an organization, of let's say a hospital, right? So a hospital has to follow all of these: leadership, privacy. Look at the number of policy. I believe there's about 40 or 50 privacy policies for HIPAA. Again, they have to follow breach notification. Remember, this applies to you as a business associate. You have to follow breach notification rule. You have to conduct HIPAA security assessment, and you have to follow these safeguards: administrative, physical, technical. Remember, I was telling you about. So again, this applies to you as a business entity. You are a vendor. You are selling your software to a healthcare organization, a covered entity. You will be signing a business associate agreement, and by doing so, an organization will know that you are testing, you are certifying, you're gonna follow, or you have followed, or you have all the policies on HIPAA security in place, and you follow protocols on cybersecurity. So again, you have to follow breach notification, you have to do HIPAA security assessment, and you have to have all these policies in place. I believe there should be about 80 or so policies, 80 policies: risk analysis, sanction, termination, access policy, patch management, password, so forth. So again, these are HIPAA security, and these are all under administrative, physical, and technical. So this is what we talk about HIPAA compliant. It's not just words, HIPAA compliant. What does this mean, HIPAA compliant? You have to follow HIPAA security rule. And what does it mean? All of these policies, risk assessment, breach notification. Again, I'm just gonna pause a little bit, give you like 10, 20 seconds to kind of go over through these security policies so you're gonna get a flavor what you must have in place. Okay. Training. And I have conducted over the years a lot of trainings on HIPAA, together with IT departments, or I had partnered with. We conducted security awareness training. We talk about phishing. We talk about encryption. We talk about proper use of emails, proper use of websites, of email. I mean, I already mentioned email and so forth. I conducted trainings on fraud, on ethics, and so forth. So you, as an organization, again, as a business associate, you have to provide evidence that you had trained your workers, because your covered entity, part of the business associate agreement, will be asking you for evidence that you trained your staff on HIPAA. And again, they're gonna ask for copies of policies. as well as training. So that's another key area that you have to understand. Here's a key slide also. You have to conduct HIPAA security assessment. And this is a requirement by HIPAA. If you recall the slide I showed you, the fines and penalties, organization had been slapped with fines and penalties by violating HIPAA because they did not, on annual basis, at least once a year, they had to conduct a HIPAA risk assessment, or they call gap analysis. You also have to conduct security standards audit. You have to conduct assets and device audit and physical site audit. So again, these are requirements from HIPAA. And again, I keep emphasizing, you are a business associate. You're gonna sign the business associate agreement. A covered entity, a healthcare provider buying your software might ask and have a right to ask you for evidence that you had conducted a risk assessment, you had trained your staff, and you have policies and procedures on HIPAA. So this is the key. And this is what they're gonna do. Before they hire you, the covered entity, they will send you a vendor questionnaire or technical due diligence because they wanna vet you. They wanna understand, do you really have all of this in place? Before they're gonna ask you to sign the agreement and buy a software from you, they're gonna do a background on you. And they're gonna submit you a questionnaire, and they're gonna put the questions for HIPAA. They're gonna ask you, do you have this risk assessment? And judging by the answers or lack of information in the technical questionnaire, you might not get business because the covered entities say you are not strong in HIPAA, you're not HIPAA compliant. We're not gonna purchase your software because we don't believe you are HIPAA compliant, and we're not gonna give you a business associate agreement. Once they give you a business associate agreement, that means they hire you, they're gonna hire your, they're gonna buy your software. So this is the key. Again, I keep emphasizing, I hope now it's gonna come to you as in all comes together. When you say, or you're gonna be HIPAA compliant, this is the key step for your business. If you wanna sell your software to American healthcare corporations, you have to show evidence that you are HIPAA compliant, and it means you are HIPAA compliant with HIPAA security rule, training, risk assessment, policies and procedures. So this is the key. And let me just summarize. I'm sorry if I took a little more time than I should have. This is I'm gonna pause here and we're gonna conclude on this note. So when we talk about privacy, again, it's what is being protected and who is permitted to use the information, how we're gonna use disclosed information. Security on HIPAA talks about how information is safeguarded. Remember those three safeguards: administrative, physical, and technical. Security is key to protect client privacy. A breach in security results in breach of client, patient privacy. And here's the summarization. I'm just gonna read out loud right now, and let's just kind of summarize and let's put all this in perspective. So when we talk about security, covered entities and business associate, in this red section here, we have to, or you, business associate, has to ensure confidentiality, integrity, availability, remember the CIA, of electronic protected health information they create, receive, maintain, or transmit. So again, you as a business associate have to ensure CIA of electronic PHI. You also have to identify and protect against reasonable anticipated threats to security. What does that mean? Cybersecurity. Protect against reasonable anticipated threats. You have to protect against reasonable anticipated impermissible use. You have to protect against breaches, and you ensure compliance by the workplace training. So this is the key summarization. I hope you realize by now, as a business associate, to be HIPAA compliant, you have to ensure CYA, confidentiality, integrity. You have to be protecting against threats, cybersecurity, against the breaches, and you have to train your workforce or staff. So I hope by now you will understand, or you beginning to understand, what we talk about HIPAA compliance for you as a software vendor. And here, just the summarization of all the safeguards. And again, there's regulations. This is in 164, 308, 310, and 312. So again, for you, if you want to do more research, this is the federal government section 164.308.310.312. Those are the safeguards. Okay. And this is it. I think this concludes my presentation. Thank you so much for staying alert with me.
Gennady, thank you very much. Thank you. So I'm sure that it's very informative and valuable for all software developers. And by the way, for not only for entrepreneurs, but at the same time for investors, because, right? And can we consider that AI, it's brilliant, but personal experience is much more valuable anyway. Yeah, so thank you very much. Thank you for sharing your experience. And if you don't mind, in detailed questions with maybe several case studies and with a Q&A session, we can, our auditorium can find maybe some similarities in the examples we were discussing with their businesses. And can we make some sort of conclusion? So before go-to-market strategy, before entering to the US market, please give an advice what on preparation level each startup, each software company should think about.
Sure, that's a great question. Yeah, like I mentioned in my previous, in the final slides, before you guys think about, business model, marketing, and so forth, you have to consider efforts and resources, putting efforts and resources in compliance. And what I meant by HIPAA compliance, you have to invest into controls and processes and documenting policies and procedures, training your workplace staff, and conducting risk assessments. So again, before you even think about presenting your software to a potential client, you have to have all of these items in place to announce to the world that my software is HIPAA compliant. Because again, by saying those words, you are attesting that you had documented, you had conducted all the necessary information, and you are full in compliance with regulations by HIPAA. So in order for you to say HIPAA compliant, you have to do that. If you don't say HIPAA compliant, there is no chance that company will even consider you for purchase, to make a contract with you. So that's the key.
Yeah, and I would tell, thank you, and I would tell to our auditorium that every company, your potential vendor, your potential customer, they have a compliance officer, and it is a checklist. Yes, we can say a regulatory checklist, and if you're not going through it, we can call it yes or no gate. It means that American company will waste their time, right, even to consider your software as a potential vendor. And could you please give a recommendation, 3 main steps? So, because usually me and Gennady, we have a conversation with directors, with founders of software companies, and plus the investors. And I would pay attention, due diligence before investor is going to invest the money, and he wants to make sure that this entrepreneur made his homework, made some even minimum understanding, right, of regulatory compliance before start sales activities and marketing. Please advise 3 main steps.
Sure. Yeah, like Rod mentioned, yes, when we sit down with these representatives, we are gonna go through this, what we call gap analysis, or the checklist. We have our own checklist, and we're gonna assess how compliant they are, or how in terms of HIPAA, and we call it again gap analysis. So we're looking for holes. So we're gonna ask them Do you follow this? Do you have these policies and procedures? Have you conducted risk assessment? Have you conducted breach risk assessment? Have you trained your workplace? So by giving answers to those, we're gonna understand what are the gaps, what are they missing. So once we gather this information and find out the holes, we're gonna give them what we call a roadmap. So we're gonna provide them with suggestions. This is what needs to happen. By considering your HIPAA compliance, you have to follow these and these steps. So again, we're gonna give them a roadmap, and we're gonna help them to implement that roadmap by providing what we call a deliverable. Deliverable will be actually giving them a risk assessment, helping them filling this out. We're gonna help them, we're gonna provide them with some policies templates. We're gonna help them to develop those templates. We're gonna show them business risk, business associate agreement. We're gonna help them to go through that as well. So those would be some of the deliverables. We also can provide them training, such as the one I provide, for example, I provided to you guys as in terms of webinar. So again, those are the key elements would be, again, starting from gap analysis, identifying which areas the company is missing in terms of HIPAA, giving them a roadmap, and actually helping them with implementation by providing certain deliverables.
Could you tell me, and could you give 2 or 3 examples from of case studies?
Yeah, so we've been reached by a behavioral health company, for example, and these are the company that providing services to children, for example, who have autism. And this is a big problem in the United States. But anyway, so they want to be considered, a quality company, and they want to be accredited by a certain accreditatory body for behavioral health and autism. And they know once the accreditation will happen, they're going to go through HIPAA audit. So they reached out to us and helped them to meet those regulatory accreditation standards. So again, I just kind of described, we sat down with the chief information officer, operation officers, and CFOs of the company, and we went through the checklist or gap analysis as well as we put those accreditation standards, and we match those to make sure that they're gonna follow the HIPAA. So that's one example. So whenever a company wants to get accredited, accreditation means a stamp of quality. So in hospitals, United States, there's an organization called Joint Commission. So that means a hospital has been accredited by this organization, and it's a very high quality standard. So behavioral health also have their own accreditation. Again, it's just showing a quality company. But again, they will be audited by HIPAA. So again, they reached out to us and we helped them to go through this HIPAA checklist. We developed a roadmap for them, and we provided with some deliverables. Another example, if you remember, there was a company that they're managing medical groups. It's called Management Software Organization, Management Service Organization. So they help medical groups or groups of physicians to get contracts from healthcare insurance companies. And healthcare insurance companies, if you recall, I mentioned about Anthem, and we have another one like Blue Cross and WellPoint and so forth. So to get contracts, those medical groups, they will be audited by health plan. And again, health plans or insurance company are looking for those physician groups a stamp of quality, again, approval that they're meeting HIPAA standards. So again, we follow the same approach, gap analysis, roadmap, and implementation. So again, as you can see, in order for companies to get better recognition, better business, and they want to get accreditation, for example, that's one example, they need to be HIPAA compliant. If they want to have business and they have more visibility from insurance companies, because insurance companies are paying those doctors, and they want to make sure that those physician groups are HIPAA compliant. So those are 2 examples I remember for those clients reaching to us. So we help them to get that HIPAA compliance in place.
Yeah, thank you. And I have 3 questions from chat. And as we know, a lot of companies and American companies and several of our customers, they have back offices and production offices or outsourcing software development to Eastern Europe, right? Or to Asian countries. And could you please explain what is the main focus, the attention they should pay to in production data and secured information, and how to organize that in order to be compliant. Because as we can consider, when European, Western European, Eastern European companies entering the US market, they have back office, right? And software development is producing there. And what's your advice even to start reorganize of structure of work with software development process in this case?
Yeah, I mean, again, HIPAA is very serious on that, because now we're talking about offshore. So now we're talking about healthcare information being stored in another country. And this is a big, big problem with the HIPAA. And again, this is they only require, and they're gonna regulate the data that is stored only in-house or in the United States. So the organization has to happen that there's cloud, the servers has to be in the United States, because it's going to create a lot of problems and a lot of issues, and those covered entities will be looking very skeptical if they find out that that information is stored on offshore, they call it, right? So the first step is to bring that information into United States, and this is the major step I would recommend.
And also, and the next question, in addition to that, could you specify some more strict regulations of California state in comparison with federal regulations, or some specific regulations in California?
Some specific in terms of protecting healthcare information?
Yes, correct.
Yeah, I mean, HIPAA is a federal government laws, but yes, you're right. States have their own regulations, and for example, now we have COVID-19 and pandemic, and that's another type of healthcare information. So California is very strict on the providing providing information to public health departments, for example, number of cases of COVID. So that might be strict. Also, California has stricter information on protected health as far as number of days or time frame when they have to report the breaches. It's more stringent than federal government. Actually, California, you have to provide information on breaches immediately, while federal government requires like 24 to 48 hours. So that's kind of two examples I'm thinking.
Mm-hmm. And could you tell me, what's your advice for software development company for choosing a vendor, even for data storage, cloud-based data storage? Let's say what they should ask from a vendor when they are starting the US expansion?
That's a good question. So those organizations would be a subcontractors of a business associate. So you're asking about the software vendor asking for data storage. So exactly. So they should follow the same path as I mentioned before as a covered entity. They should conduct a technical due diligence, because again, that subcontractor is going to be working now on behalf of a business associate. So they have to get assurance that the data storage organization is HIPAA compliant as well. So they have to assess them by security. They have to assess their security control, cybersecurity framework, and so forth. So that's a very valid question, and I would recommend follow the same approach that the covered entity would follow on business associate.
So we can say also that this is some sort of culture of record keeping. When you are asking from your vendors the documentation, and you should know what to ask, right?
Exactly.
So in order to be compliant, you should make sure that your vendors are compliant.
Absolutely.
Yeah. And when you are dealing with a cloud-based data storage company, so you have to also use this, we can say yes or no gate and some checklist, and receive from them the confirmations that they are compliant. And we are going to the last question, AI, right? AI is working with data, and now in this period of time, everybody are thinking about automatization, and of course, healthcare is the one of the industries where it's popular and it's growing market. And could you, from your experience, could you tell the weak points, or we can call it tricky questions in AI data? And by the way, when you are using the data for analysis, data taken from somewhere, right? And that's your general conclusion about that. It will be interesting also.
I would just say, you know, the AI is just a tool. You know, these are, you know, we can, you know, robots, machine, whatever you want to call it, data automation and robotization. These are tools. There are people behind the tools. And if you just rely on the tools, I mean, tools are great because they're going to help you to be more effective, more efficient, and so forth. But you still have to be compliant with regulations, and you have to train the staff how to approach and deal with the data. So, and you have to have strong cybersecurity controls in order to protect your data. So again, the HIPAA standardization, I mean, HIPAA compliant is not going away with the AI or not AI. And again, these are just tools. So you can't just fully rely on that. You have to have strong processes, internal controls in place in order to make sure that data is confidential and stored, you know, privately. So again, my advice is just to not utilize UI as a tool, AI as a tool, but still not forgetting the complete pictures in terms of HIPAA compliance.
And am I right? Thank you very much. And am I right that maybe on the second or third step, what you called actual implementation of a regulatory compliance roadmap, we are recommending to our customers to make audit and to receive the confirmation from trusted, reliable hypersecurity American company. And only after that, it will be a very strong argument from your side that your product is not only competitive in function, but at the same time, it's safe and 100% legal. Yeah, so yeah, thank you very much. Thank you. Daniil, do you have another questions from chat?
Yes, we have some questions from the live stream as well. But on my end, I would just wanted to add that I really enjoyed this talk, specifically because you guys put it like on a very high level, sharing your expertise. It's visible that you are the experts in the fields, and it's amazing to have so much valuable information during so short period of time, and I'm really grateful for that. So first question I have, just a second. We are the solution for insurance companies what we are doing is basically what the guys are doing. They are building a software solution aggregating insurance companies in one place, and they want to make it simple for organizations and for private people to select the right insurance with their algorithms. So the guys are asking what they need to take into account from your perspective when they would launch it in the United States.
It's just a matter of do they collect data on patients, or these are just
specify, but I would assume yes, because
and that's the key. If we're talking about protected health information, if they're collecting data of all of these fields that I described and identifiers on names, addresses, date of birth, so that becomes protected health information. So if they do, then they have to follow all the HIPAA requirements I just described. So if they don't, if a person just choosing a plan, I mean, I need to understand what kind of data they're collecting on the clients. If they're collecting personal protected health information, then they have to follow all the HIPAA rules.
Yeah, I guess they can reach out to you directly. Yeah.
And I would add that in insurance industry, it is a huge market in the US of billing companies, helping to doctors, small, medium, and large companies to make payments and operations with billing. And the audit for billing company or anything connected with billing, even it is combined with healthcare data or it's split, it's under a serious regulation. And HIPAA security completed the same framework in this regulatory compliance pathway.
Yeah, before I move to the next question, I will give some perspective from my end in terms of what I just heard from you both. I think considering that we are a community of entrepreneurs, founders from around the world, they are trying to enter, for example, United States market, and for them to raise capital from US investors, they also need to be compliant with local regulations and laws. But in order for them to get customers, they also need to be compliant before they sign any contract. So on all perspective, this is it's not like you enter the market and you just start selling right away. You can hit some obstacles on the road, and it might damage your business significantly, or may even kill your business. So that's the steps very important that we discussed today.
Absolutely agree.
The other question I have, and I think we can wrap it up afterwards. What do you think, Rod? I think we would let Gennady go, and we can wrap it up. So because I mean there will be still more questions. I have another one. It's a software solution called DiagnoCat. So it's diagnostic error-free. It's artificial intelligence for interpretation of dental computed tomography images. The guys are asking if they have what they need to take into account entering the market.
It's the same thing as HIPAA compliance, but also if they're talking about laboratory and stuff, they have to follow FDA compliance. Am I right, Rad? So there's another layer, and they can talk more with him. But again, these are all healthcare related information, and they have to, like you mentioned, even to consider any type of business, they have to be HIPAA compliant and they have to follow all these regulations. So, but because what I hear, I'm assuming they also have to follow FDA compliance as well, which is Food, Drug, and Administration. So that's actually an extra layer.
Yeah, thank you very much. I think we are almost done. And before we close the session, and I will let you, Rod, and Gennady close the session with a word of wisdom or recommendation to the audience, the final statement that you want the audience to leave this session. And before we do that, let me show a few slides about our upcoming webinars to the audience, just a few seconds. And I'm sharing the screen. So, so for those who enjoy our webinars and would like to meet such knowledgeable experts in the fields for your businesses, we are bringing regularly speakers with like very specific expertise to help you move your business forward. And next week we will have a webinar in Russian for those who are trying to raise capital, and Yaroslav, the co-founder of Absolut, will tell you a perspective of how to raise non-venture funding. We also have, for Russian-speaking audience, the opportunity to pitch and get feedback. It's an ongoing session with our two leaders, Sergey and Vyacheslav. They are giving you feedback once a week during live stream every Tuesday. We partner with 500 startups. We launched a joint initiative which is called Go Global Series with 500 startups alumnus, and alumnus sharing their failures, their route to success while they were starting their business and getting where they are right now. And this series of webinars has started a week ago, and it's going to be once a month. We're going to bring you the best people from their alumnus sharing their expertise. So make sure that you have your questions ready already now, because it's going to be a competition of questions. Last time it was just, we couldn't even cover half of the questions we had. We do monthly meetups with founders. This one is in Russian every last Friday of the month. So it's going to be like in a week or so, in 2 weeks probably. And the other one, we have Global Founders Monthly Meetup in English with founders from around the world. They are meeting to help out each other to build their global network. And once founder meets, there is magic happening. So you guys can help each other to reach each other's markets. And this is where we basically do it every month, every first Friday of the month. So join us. It's going to be very useful for your businesses, and it's free. These are our global partners. We basically have lots of large partners that represent large ecosystem of local markets like Skolkovo, like Innopolis, like all large technoparks in Eastern Europe and CIS region. But we have partners in Australia, like Gold Coast Innovation Hub, MindHigh, Collaborativa Mexico, and many other great partners we are proud to be partnered with. And if you would like to get in touch with them or learn about them, you just go on our website and you can have all full access to them, or we can connect. And that is all. These are our contacts. You can reach out to us with your questions, or you would like to help us out, so just let us know or learn about us through our website. We are a nonprofit organization that is that has a mission to popularize entrepreneurship around the world, where we build our global strong network and reputation. The reputation here is in the center of everything. That's it on my end. And I guys think this is time to close our great session we had today. I'm really grateful for your time, and I'm excited that we launched this series of webinars with Rod, and Gennady was the first great speaker we proudly invited and proud to have. So Rod and Gennady, feel free to give the final statement, please.
You first, Gennady.
Again, I just want to thank you, Daniil, and Go Global for this opportunity. And what you just said just a few minutes ago, I mean, you kind of nailed it before. So I'm just going to leave you with this. So before you consider entering the market, to have some kind of opportunity or some kind of have a competitive advantage, you must invest resources and efforts into compliance. I mean, that's just step number one. And I mean, I cannot emphasize this enough. And I know with working with Rod, and he had expressed so many times he had heard, and people talk to him about that. And he realized that people did not even realize that compliance was such a huge factor before they even start launching the product. So again, this is just my announcement to you that to consider launching a product, consider have any kind of entrance to the business United States for your product, as we talk about software in healthcare, you must invest into HIPAA compliance, and that's just it. I mean, in order to have even a door, opening the door. I mean, that's just what I'm saying.
Yeah, thank you very much, Gennady. I'm really pleased, and I'm proud that I have such a colleague and partner. And to be short, just plan your go-to-market strategy with serious attention to regulations. Read, explore, make your homework, and only after that, come to the customer in order to avoid potential future problems, and or just ignoring your product. Come with a compliant, legal, prepared product, your software, and we wish you the successful expansion of the US market. Me and Gennady, we will be glad to answer your question in a regulatory compliance chat in Go Global, because we are proud members of Go Global. And please write your questions there. You can contact us there, or at our internet page, roadup.us, and we will be happy to help you, because I'm sure that the US market is huge, and at the same time, it's very strict regulated. And please start planning your business.
Thank you so much. And so since you mentioned that, we need to tell the audience the name of the group, which is Go Global Expert and Compliance. You can find this group on Facebook and connect with Rod, with Gennady, and other people related to compliance in the United States. So on this session, we had Rod Tuvaev, who is leading this series of webinars with related to compliance and regulatory in the United States, and Gennady Daič, who was covering the very important topic, HIPAA compliance in MedTech. Have a great day, and thank you so much for your time. Goodbye, guys.